Thank you so much. And it's my pleasure to introduce Dr. Dimple Patel, who is a managed care pharmacist from Memorial Care Medical Foundation. Dr. Patel has experience in both direct patient care as well as pharmacy utilization management. And she is a strong advocate for patient-centered care. Today, she'll be talking about practical strategies for discussing medication costs with patients and addressing affordability barriers, a vital step towards improving adherence, trust, and outcomes, and ties closely to the presentation that we just heard from Dr. Kittles. And with that, I'll turn it over to my friend and colleague, Dr. Patel.
Thank you, Cindy, and thank you all for your time. The team just asked me to briefly review some logistics, right, regarding those drug access challenges within heart failure. So beyond prescribing the right things, which Dr. Kittleson just covered so wonderfully, beyond convincing your patients to take those right things, as was discussed in the first hour, what can we do to help ensure our patients can actually afford those right things, right? We often ask about adherence, but oftentimes patients might interpret this as, do I forget my meds? And we might not get an accurate reflection that addresses any cost-prohibiting non-adherence. So maybe we're a little bit more direct, have you been able to fill your meds regularly? I know some of them, like the Jardiance or Entresto, for example, could be costly. So you're just acknowledging the cost and you're letting the patient know that they can talk about this with you. We need patients to tell us about this before we can guide them to any potential solutions. So if they do report these issues, let them know there are both income-based and non-income-based assistance programs out there for most brand name drugs. Pharmacists or case managers can often support in finding these, and I will review just a few of them quickly in just a second. And I'll also suggest documenting any cost-related burdens or non-adherence in your notes. There may be a need for chart documentation for some of these assistance programs. So it's good to just have this ready and documented in your notes, just in case. And I think we talked about this, the ability to be flexible. We want to minimize self-discontinuations or med rationing, right? Potentially negating the beneficial effects of these drug regimens. And in certain cases, maintaining an SGLT2 and an ARNI may just not be financially feasible. So maybe an ACE in this case could at least ensure some access when we need to. I think it's a good idea to just routinely get a pulse check on our patients' drug affordability. And then on the next slide, I've just got some options here for discount programs, specifically surrounding the SGLT2s and the ARNI drug class. These are the two big categories as far as affordability goes in HFpEF. HFrEF. Farxiga does have a generic available. I will say that there's not strong formulary uptake right now, and the generic Entresto, the ARNI, right, should launch in the second half of this year. We don't know to what extent it'll be discounted or how quickly it'll be added to any formularies. So the first section I have are income-based patient assistance programs from branded manufacturers. There's no universally accepted income across the program. So if your patient's just not fully sure whether they'd qualify or not, it might be worth having them answer one or two screening questions online related to household income and household size. That'll quickly tell them, if they're past the threshold or not. Shifting to the second column, these are the manufacturer copay cards that are not based on any level of income. Now, they generally do require a patient to have some sort of commercial drug coverage for the agent. Your office or staff could fill out these forms for them online, or these applications or sometimes even the community pharmacy might do the forms for them if they do see a high copay. Or if you have access to case managers or clinical pharmacists, that would be wonderful as well. But I will say, ideally, the patient or the family is probably the best ones to register for these and present the information directly to the pharmacy. They are very straightforward. Lastly, just more for completeness, I've got some cash pay options listed. I'll say that the options for the drugs that we're talking about right now, these aren't wonderful options for that. You know, a patient could get Farxiga for 60% off on some of these websites, right? But that still comes to about $286 for a 30-day supply. So while it's a huge discount, it might just not be reasonable. I've got the links posted up here, but honestly, I've found that just going to the drugs websites is the easiest to start navigating these processes. So I will end with that. Thank you.